This is April Lomax. Hopefully, I'm coming in a little bit louder and clearer. Dr. Willis, can you hear me now?
I sure can.
Awesome. Thank you so much for bearing with us, y'all, as we kick off our first Twitter Spaces conversation. Dr. Andrea Willis, as you all know, is our Chief Medical Officer for Blue Cross Blue Shield of Tennessee. Dr. Willis, can you get us started sharing a little bit more about the partnership between Blue Cross and Meharry?
Sure. Good morning, everybody, and thank you for joining us. So I felt like Blue Cross Blue Shield of Tennessee had to view itself as a part of public health. And public health is when all stakeholders come together to impact the greater good. And I'm grateful that we've moved forward with that mindset. We have unique data with our claims information. We hear directly from employer groups. We have a strong analytics team that does predictive modeling and analyzes our data, not just for us to take a look back, but for us to be proactive in trying to serve our members and the community. And one of the things that happened early on in the COVID pandemic is that we knew that we needed to proactively reach out to high risk members. And so what we did was we developed our own social vulnerability index, and that's a scoring system that assigns scores based on factors like safety, food insecurity, housing, healthcare access, and health literacy. A higher score means more negative impact to health. But as we were doing this work, we were clear that we needed a well respected partner that could not only validate our results, but that had a voice that resonated well with high risk communities. And in my mind, there is no better partner than Meharry Medical College.
I'm sure Dr. Hildreth will agree with you. Let's get him into the conversation to talk a little bit more. Dr. Hildreth, can you hear us? And let's do a quick mic check with you. Dr. Hildreth is getting his audio so that he can join us in the conversation. While we have you, Dr. Willis, I'm interested as we kind of come into or well into February. As we all know, it's Black History Month, and the theme this month is Black health and wellness. What does that mean to you, Dr. Willis, especially as we think about all of the good work that you're doing at Blue Cross? What does that theme mean to you?
So we've heard this so many times before, but I really believe it's true. Black health and wellness means being well in mind, body, and spirit. And I think both the COVID crisis and social injustices we've witnessed in the past couple of years made us really reflect on that. I know I found myself in a place where I had to say that at times I just wasn't okay. And I knew many others, including some of those we served, felt the same way. So I think the difference now when we say we want to be well in mind, body, and spirit, it extends not only to individuals, but we want that wellness for communities. We want that wellness across the entire nation. And we want policies that institutionalize that. And we want providers embracing culturally competent care.
I know I'm taking that as a theme for me for the rest of this year, wellness in mind, body, and spirit. We're going to talk a little bit more about culturally competent care, but I want to invite Dr. Hildreth and see if we can check his audio and see if he can join the conversation. Dr. Hildreth, can you hear me okay?
Yes, good morning. Thank you. I can.
Good morning. It's so good to hear from you this morning. As we mentioned, Dr. James Hildreth is the president of Meharry Medical College. I'm so excited to be in conversation with you today. Dr. Willis has shared a little bit about the partnership between Blue Cross and Meharry. Can you tell us from your perspective a little bit more about that partnership?
Well, so thank you, April. It seemed like a natural partnership for us because Blue Cross Blue Shield's focus on what we call the social determinants of health is really what we've been about since 1876. So it made perfect sense for us to partner with Andrea and her team to look at the data and try to make some decisions about how best to move forward and serve the people that we serve. So it just seemed like a really good thing for us to do, and it's been a great relationship so far.
It certainly sounds like it has. You all, Meharry is the largest private, historically Black academic health sciences center in the U.S. So I know this theme of Black health and wellness is probably something that you all talk about and live day in and day out. But can you take a moment and just kind of talk to us about what that theme for this year means to you?
Well, for one thing, April, it means that what Meharry has been doing for 145 years is now the subject of a lot of attention, and it's really this year's theme. We take pride in the fact of trying to offer culturally competent care to individuals, which means meeting them where they are and understanding the context in which they find themselves not healthy and well, and trying to address all of those different issues. It's kind of challenging without having all the resources that we need, but that's been our approach from the very beginning. And as you mentioned, uh, we do, we have been around for a long time. We're the largest private Black focused academic health science center in the country. And there are a lot of things that I could mention, but just to give you a sense of how impactful the institution is, we train or have trained more than 40% of all the Black dentists in the United States, even though there are 68 schools of dentistry in the country. So we're just thrilled about the theme for this month and this year, but really thrilled again to be in partnership with Blue Cross Blue Shield.
Appreciate learning more about Meharry. Certainly some things we already knew and some new things. Excited about the partnership between Blue Cross and Meharry. And so we're going to take a deeper dive into some of the conversation. We got our listeners, I know, are eager to hear more. We have Elizabeth Fight from the Chattanooga Times Free Press. A lot of people here to learn more about culturally competent care. And I know you both mentioned that in your introductions. And so we want to dive deeper into what that really actually means. Dr. Willis, let's start with you. Can you explain what culturally competent care looks like and what providers can do to really increase their knowledge in this area?
Sure. So I'm sure there's a lot of definitions out there, but the one that we work from is that culturally competent care is the ability of providers and organizations to effectively deliver healthcare services that meet the social, cultural, and linguistic needs of their patients. And just to give you an example from my own personal viewpoint, I was born in a neighboring county to the one my family lived in. They were more professional in the neighboring community for pregnant Black women. It was the better chance of having a non-complicated delivery. And healthy deliveries were not a given for Black women then. And unfortunately, there are still too many Black women dying today during childbirth and having high-risk pregnancies. So it really is about being sensitive to the cultural needs of the patients. And there is education out there. I know the March of Dimes has a curriculum, for example, but providers can also look to community resources. And again, we are partnered with the great Meharry Medical College, and there are so many learnings that can come from Meharry as well.
Dr. Hildreth, you talked about how you all are training, have trained so many exceptional health practitioners. What advice would you provide or share for fellow medical professionals as we think about culturally competent care?
Thank you, April. I think for us, it just comes down to visualizing or assuming that the person sitting in front of you is someone that you care about, that their purpose of being in front of you is to have their health restored, but realizing that health is not just offering healthcare, because as we understand it, healthcare only accounts for 10 to 15% of being healthy. The rest of it comes from where you live, where you work, how much money you make, what language you speak, and all those other things. And we just want people to factor those things into the treatment plan and also into how we interact with people. When you take that context into consideration, it allows for you to have meet people where they are, as we say, and offer better care to them. And what that does is it engenders a level of trust that is needed for that person to be fully disclosing of all the details relevant to their condition, which is necessary to offer them the best treatment. So that's kind of our approach to it. It's just realizing that the person in front of you is a person and they have a context of their lives and their disease or unwellness that needs to be taken into consideration when you develop a treatment plan.
Awesome. I know the audience is filled with a lot of medical practitioners in the field. So I know that's advice and words of wisdom that all of us can really live by in all of the ways that we interact with members. We've touched on and talked about a lot of ways that Black Americans face increased risk historically, present day, for a variety of health conditions. But I think it's really more important to talk about how this happened. And certainly, Dr. Hildreth, you got into that a little bit. I want to take a deeper dive with both of you to talk about the factors that contribute to some of those risks. Dr. Willis, we'll start with you, and certainly Dr. Hildreth can add into that.
Great, thank you. I think education is key. In medical school, certainly we learn how to take care of diseases. I think probably not enough. We learned how to take care of the people with the diseases, meaning taking into account the risk factors they had associated, the comorbidities that they could face as well, the environments that they're in. I think that's a difference. And to Dr. Hildreth's point, we have to move from talking about healthcare to talking about health, because the only part of that happens behind clinic walls. So much happens in the environment, in the communities. So we really have to take a broader look. And I think education is the key to that. I think, honestly, we even have to have the discussion of where this country has come from and where we want to go. I mean, certainly, we hear about the enslaved people not having medical care at all. In the South, we know well about the Tuskegee syphilis experiment. So there are definitely things that have happened in this country that we've got to acknowledge, that we've got to address for us to be able to move forward.
Dr. Hildreth, what would you add to that?
So thank you, April. I think Andrea has really laid out what we call the social determinants of health. And there are 5 major factors that are normally thought of. One is education and access to quality education. One is access to healthcare and the quality of that care. Then there's the environment and the built environment and where we live. Then there's the social context of our lives and economic stability. Those are the 5 major factors in the social determinants of health. I call those 5 degrees of separation between persons of color and good health. But there's actually a 6th degree of separation that cannot be overlooked, and that is technology. Because as we move forward, it's going to be delivered through technology, and there's a huge, as you're probably aware, technology gap that exists as well that we need to take into consideration. But on top of that, there is a wedge that is separating people from good health, people of color at least, and that's racism. And there's no way to get around it. If you dig deeply into all of those 6 degrees of separation, you're finally going to find yourself confronting and having to deal with systemic racism and bias that has been in place for many, many decades. And again, I congratulate Blue Cross Blue Shield and other organizations that are acknowledging this and making great efforts to deal with it. But we cannot ignore that as a major factor, on top of the other factors we've talked about.
Everything that you all are saying gets me excited about how we move forward and all the actions that each of us can take to really move this conversation from conversation to action, right, in our different areas. I have one more question that I'd love to ask, but I want the audience or remind the audience that we will be taking questions from them. So get your questions ready. But let me just ask one more, because I always like to kind of end my segment around this. And it's really about the hope, right? Because especially as I kind of think about everything that you said, Dr. Willis, and certainly that you've shared, Dr. Hildreth, I'm hopeful. And it sounds like in addition to the action steps that we're taking, there's also a little bit of if we can sprinkle in a little bit of hope, right, that can take us a long way. So, Dr. Willis, what are you most hopeful for as you kind of look toward the future?
I am hopeful that we will continue to break down walls between different sectors within the healthcare community, that we all come together and we really think about the people that we're trying to serve. I mean, we learned all through growing up, you treat people the way you want to be treated. And I think that still stands here, definitely when we're talking about health. So I have hope that we'll continue to do that. I also have hope that with what we saw, with people really standing up around social justice in the past couple of years, that we're seeing a generation that really does care about it, and that we continue to impart to them our experiences and our wisdom, and that they will carry the torch forward. So that is my biggest hope.
I think all of us probably share in that same sentiment, Dr. Willis. Dr. Hildreth, what about you? What's your hope as we look toward the future? And then we'll take questions from the audience.
Thank you, April. I agree with Andrea, Dr. Willis, that the interactions and collaborations between large organizations is really a wonderful thing to see. It's clear to me that hospital systems and large health systems are not best equipped to deal with the social determinants of health, but many of them have forged relationships with community organizations that have been doing this for a long time, but lack the resources or the capacity to have the change they want to have. So the collaborations and partnerships that we're witnessing today are really encouraging to me. I'm also encouraged that there's a whole generation of young people, not all of whom are persons of color, who have decided that this is something that has to change, and they've committed their careers to doing so, and that also gives me a great deal of hope.
I know that's right. Shout out to all of the listeners who I'm sure are interested in this conversation and thinking about what each of us can do in our respective roles. We have a question from John. I want to invite John in to ask his question. John, it looks like you're on mute, but feel free to come off of mute and ask your question.
Thank you, April. Thank you, Dr. Hildreth and Dr. Willis. It's been a great conversation. I'm interested in that kind of forward-looking theme that you've taken here. So I'd love to hear an example of something you've seen as a positive shift in thinking or approach. Maybe that's unlearning of kind of faulty ideas from the past, or some proactive steps that you see healthcare providers taking now to address social determinants and health inequities.
I'll just give a quick example. For example, Aetna CVS, as you know, CVS up until recently had a location, a physical store or physical presence within 3 miles of 80 or 90% of the US population. And they've decided that by having those physical locations have connections to community organizations, they can have a more impact on the health of the people they care for. It's just one example where I'm talking about that these large organizations with tremendous resources and outreach and presence are partnering in a way to help the local organizations have the impact they want to have. And I think that example should be repeated by other organizations as well. That's just one example of the kind of partnerships that I'm referring to.
And I'll just add one of the things that I was excited to see, and Blue Cross participated in this as well. We, with other corporations, we ended up banding together to increase broadband access in the Hamilton County area. That's because we saw definitely the importance of it when it just came to education in general. But as we're excited about the expansion of things like telehealth and healthcare delivery, there were some people that were disadvantaged. And so companies came together, put together some funding to increase broadband. That's just the start. And we know that those communities had to play catch up. But I am excited to see the corporate community stepping up to try to help as well.
Awesome. I think we have time for a couple more questions. Feel free to send a request and we'll invite you to come off of mute. Again, we can take questions for Dr. James Hildreth, President of Meharry Medical College. We have Dr. Willis on the line, Chief Medical Officer for Blue Cross Blue Shield of Tennessee. So feel free to come off of, to send in your request, and we can take a question or two. Valerie, I see you have a question. Feel free to come off of mute and ask your question to Dr. Hildreth or Dr.
Yes,
Willis.
good morning, Dr. Hildreth. Good morning, Dr. Willis. Thanks so much for all your input this morning. It's really appreciated. I was wondering if, Dr. Hildreth, you could talk a little bit about the education piece of it. I'm sure you see so many wonderful, talented folks come through your program. What can maybe communities do, or people in communities like myself do to support people who are doing their education? Is there a way to seek out practitioners that are culturally competent or anything like that we could do on a personal level?
Thank you for that question, and thank you for an interest in supporting those who are in training. One of our biggest challenges, of course, is our students graduate with tremendous amount of debt, and we're making an effort to reduce the debt burden, because when students graduate owing $300,000 or $400,000 in total debt, the choices they make or feel able to make in terms of what they're going to do can be impacted by that. Most of our students choose primary care, and for the last many decades, 80% of our graduates, both medical and dental, have gone to areas that are underserved. So we'd like to keep that momentum going, and we fear, though, that if we don't find a way to reduce the debt of these students, that's going to change. So we're furiously trying to raise money for scholarships and look for other ways to reduce that. But one of the ways that would be helpful for the general public to assist in this might be to convince the elected leaders that investing in the training of physicians who are focused on primary care might be a great investment for the nation. And so I would just say that that's one of the things that we've been trying to do, is to convince the elected leaders that investing in the training of primary care physicians, at least, would be a great way to impact the health of the folks in our country. But it's a very important question, and I do appreciate that.
I know that was directed to Dr. Hildreth, and I'm so excited that you asked the question. I'm so excited about the answer that he gave. And we believe that as well. We have increased the number of scholarships for minority students pursuing healthcare professions. That is so important for our future.
Thank you both so much.
Again, feel free to come off of mute or send in the request, and I'll invite you to come off of mute and ask your question to Dr. Hildreth or Dr. Willis. If not, then I know, guess I'll ask this one last question. Maybe hear from you, Dr. Willis, and then Dr. Hildreth from you. What's one takeaway or one thing that you would want our listeners to take away from this conversation? And again, I'm looking through the list of participants here. Every position in the medical field is probably represented here. So as we think about this broad audience, what's one thing that you would want people to take away?
I would say the thing I want people to take away, even though we're talking about Black health in Black History Month here, it really is about the community, because if we make sure that everyone has access to culturally competent care, then it helps everybody. It lifts the entire community. And so it's not a problem that affects one segment of our population. We have to think about it affects us all. And if we do well by everybody, we're all better for it.
So, April, this is Dr. Hildreth. I agree with what Dr. Willis has said, and I would just encourage everyone listening to understand that by collaborating with each other across our disciplines and across our organizations, that's going to have the most impact on the care and health of all of us, as Dr. Willis said. So I just think that this theme of partnership and collaboration is one that needs to be pushed and and carried forward. And if we do that, I think it's going to have a great impact on the health of our communities. And I do appreciate a chance to be part of this conversation today.
Well, I appreciate it. Thank you so much, Dr. Willis, Dr. Hildreth, for sharing more about your perspectives around Black health and wellness, talking a little bit about the collaboration between Blue Cross and Meharry, and certainly the things that all of us can think about, can do to help move us forward. Appreciate the time today, and thank you to each of you for listening.
And thank you, April.
Thank you, April.